are, which are actually the state legislature that's refusing to get us Medicaid expansion. So go ahead.
Don't let them put words in your mouth.
I'm not putting words in your mouth.
Thank you, John. And Mayor O'Neill, welcome to Prince William County.
Thank you.
We're thrilled to have you here. We're behind you all the way. We got the same types of issues here in Virginia that you have in North Carolina, and I think working with you, we make a great team. I want to tell you there's a wide variety of diversity of people here, including a diversity of elected officials in all kinds of different capacities. Standing next to you is Lily Jesse, a member of the Prince William County School Board in the Occoquan District right here. Next to her is Delegate Ken Plum from Fairfax County, came down, and he's a strong supporter of Medicaid expansion on closing that coverage gap, and he has a long history of working hard on all these things. If you see his car over there, it has license plate number 1. There's a reason for that, because he's number 1 in seniority in the House of Delegates. So. All right. And of course, next to him, you know Michael Frutel from the Woodbridge area, also in the House of Delegates. And we have former Mayor Ernie Porta from the town of Occoquan, just down the street here, right by Route 1. And standing next to him is Father Lateef, who ran for chairman of the Board of County Supervisors. In addition, Frank Principe, who's on the Board of County Supervisors, is Executive Director of the Health Center here. He couldn't be here tonight, but we have Lisa Wiener, one of the practice directors, who'll be speaking shortly. So we're with you. We want to make sure that the things that you're working for get done, because they're the things that we want. They're the things that we want to get done. We also thank you for inspiring us. Probably not too many people here knew where Bellhaven, North Carolina was until he started walking. And certainly nobody knew that it was 273 miles from Bellhaven, North Carolina to Washington, D.C. But he's proven that it's a distance that can be covered, a distance that gets done, that he's getting done almost there. Now, I was, yesterday and today, I was at a 2-day meeting over in Maryland, the Metropolitan Washington Council of Governments. And after our sessions yesterday afternoon before dinner, I went out for a 4-mile run. Pushed the pace and everything, really worked it hard. My legs were a little tired, but I kept up the pace all the way in. I felt great about myself. Then I got up this morning and tried to run another 4 miles. And I just couldn't run as fast today as I ran yesterday. And as I was running this morning, or whatever I was doing, I was thinking, this is 4 miles. He's going 273 miles. So you are an inspiration. And I'm not going to go out and run 273 miles tomorrow, but I thank you for helping push us to do the right thing here. Mayor O'Neill is tackling a problem that exists in North Carolina, but it's also a problem that exists across the entire country, and particularly in the states that have not acted to close the coverage gap, that have not passed Medicaid expansion in one form or another, either through expanding Medicaid or through setting up a private alternative, which several states have done. The impact on hospitals and community health centers in many instances is significant. Several of them are closing. Those that are most affected are rural areas. So it's mostly in the rural areas where we've had hospitals closed. Data came out just recently showing that in rural areas across the country right now, rural hospitals, more than 40% operated in the red. That means they spent more than what they took in. Some of them have closed just in the last year or so. But a lot more are threatened with closure if things aren't done to be able to address this issue. With 40%, that's almost half of the rural hospitals closed, you can imagine the impact that could have if, in essence, half of the rural hospitals across the entire country closed. Now, at the same time, there are some things that are happening that can protect those rural hospitals. Those states who have adopted Medicaid expansion, and half the states have, what they have seen just in the first few months of this calendar year, 2014, is a reduction in uncompensated care. That means people who show up at the hospital or show up at the emergency department are uninsured and can't pay anything. Charity care that's provided by the hospital. That's gone down by 30% just in the first few months. Can you imagine what that can do to those hospitals that are struggling, haven't gone bankrupt, but are still a little bit below the line in terms of their resources, if they had that 30% reduction? And if it's 30% in the first few months, it's going to be double or triple that pretty soon. So this is not a problem that can't be fixed. It's a problem that is being fixed in some states, but is not being fixed in other states such as North Carolina and Virginia. Now, as the mayor mentioned, there's a hospital in Virginia that closed just last year, October of 2013. That hospital is in Lee County, Virginia. Probably as many of you have been to Bellhaven, North Carolinas have been to Lee County, Virginia. It's in Virginia, but just barely. It's the county that's farthest southwest in all of Virginia, wedged in between a portion of Kentucky and a portion of Tennessee. Just to give you a little perspective on where it is, it's west of Detroit, and it's closer to the capitals of 8 other states than it is to Richmond. Wow. It's out there. Most significantly, it's also a rural, poor mountain county. There actually are a fair number of jobs there, but the wages by and large are minimum wage jobs are just barely above that. People have very limited resources. Fortunately, they've had a hospital for a number of years. That hospital started struggling and last October closed. That was bad for the people who live there in terms of their health care services. Because not only did they lose the hospital, but guess what? A lot of the doctors who worked there picked up and moved to other places where they could practice. So they've lost access to medical care on an outpatient basis as well as on an inpatient basis. And now many of those people have to travel over the mountains to go to hospitals in either Tennessee or Kentucky to get their care. But it also was devastating in many other respects to that community. As I said, it's a very poor county. For school system, K through 12 education, we pay in Virginia, we provide money to localities based upon how much they can afford. Generally, the state pays about half of it. In some places like Arlington, Alexandria, the state pays only 20% of the cost. In Lee County, we pay over 85% of the cost because they don't have the resources and the tax base to be able to generate. So it's a county that's already been struggling. When the hospital closed, they lost their largest employer. So it was the largest employer in the county. Same in your situation.
And our industry is retirees moving in.
Yeah.
And now we don't have a hospital.
They won't come.
Many of them won't come. You're exactly correct. So you've lost, so the community has not only lost its hospital, it's lost its outpatient services, and it's suffering in terms of jobs because it's lost those. Can you imagine being the Director of Economic Development for Lee County, Virginia, and trying to get companies to come to a county that's lost all these jobs, that's lost its healthcare services, and saying, bring your employees with you? You're not coming. So these types of things, when they happen, they have much more significant, much more longer-lasting effects than just the closure of the hospital. What we have to do is to address this in a comprehensive way to help keep this from happening. And like you talked about in Virginia, we have 8 critical access hospitals. Those hospitals are threatened with closure if we don't close the coverage gap and provide the resources to help take care of things. In Virginia, as you well know, we have not yet acted in terms of closing that coverage gap. We've tried through the state legislature, we've gotten legislation included in the budget this year in the Senate, but we've been blocked in the House of Delegates. The House of Delegates has resisted it. Interestingly, given the impact upon rural areas, with the resignation recently of Phil Puckett, there are now only 2 legislators in the entire General Assembly out of 140 who represent largely rural areas and supported closing this coverage gap. Rosalind Tyler, a Democrat House member from the Southside Virginia area, and Emmett Hanger, a Republican from the Harrisonburg area. And like you said, it should not be a Republican or Democratic issue. We had 3 Republicans work with us in the Senate to get this done, and we have an opportunity to address it, but we couldn't get the House to get it done.
They're hurting their own constituents.
They're hurting their own constituents. That's exactly what's happening. In terms of addressing this issue, the opportunity we have, and we need you to keep pushing and be public on this, is to get the governor, is to support the governor who's looking at addressing it administratively. There are options that are on the table, figuring out what legally they can do. He's going to indicate it, he's going to come forward with a plan by the end of August, beginning of September, on how we can implement this to close the coverage gap without having to go through the General Assembly, through the legislature on that. So that's what we're going to do. Finally, I want to say that the issue of rural hospitals is a huge issue, and we all should be paying attention to it, regardless of whether we're from a more developed area or a rural area. But it's not the only one. It's a matter of health care. The woman you talked about is not the only one who dies because they don't have services. I had a constituent a couple of years ago, and was not from Prince William, but just outside here in the Lorton area, who had hepatitis. Liver was failing, needed a transplant. He had been at the old Potomac Hospital here in Prince William, and had been at UVA Hospital in Charlottesville. UVA said, we'll do the transplant. It's not too hard to do transplants for livers. It's something, the liver can regenerate. So it's actually one of the easier types of transplants to be done. We can give you a liver that will keep you alive. But we're not going to do the transplant unless you can get the anti-rejection medications to keep you alive. He applied twice for Medicaid coverage under disability, but he was working part-time whenever he was feeling good and got turned down. And in the end, he did not get the transplant he needed because he was not able to get the Medicaid coverage to be able to get those anti-rejection medications. He died. I talked to him in the morning, he died, and he was losing some coherence there. And unfortunately that afternoon, before we were trying to figure something out, he died. He's not the only one. We also would get $2 billion a year, which would be a boost to our economy here. And our economy needs a little pickup right now. It would create 30,000 jobs in Virginia. It would be good for Virginia businesses, which is why the Virginia Chamber of Commerce and many others have supported it, because businesses would see a benefit in terms of their health insurance premiums. They're having to pay extra for health insurance premiums to cover the cost of the uninsured in the hospitals. It would also mean we would get our fair share back, because we're paying money into the system right now to provide this coverage. We're just not getting it back out. So we're paying in about $5 million a year from $5 million a day from Virginia and not getting that back out. And in addition, those who opposed Medicaid expansion or closing the coverage gap asked last year that we get a private entity to do an assessment of what the cost would be, the net cost would be to Virginia's budget if we expanded. They did that because they didn't trust Governor McDonald's staff and their calculations. So they hired PricewaterhouseCoopers to do the analysis. And what they came back and said was between 2014 and 2022, expanding coverage would not only not cost Virginia taxpayers additional money, it would actually save the state $1.1 billion out of our budget. We got to take care of it. You got to help the people in North Carolina take care of it. Working with you, we can get it done. Thank you very much for coming here. Welcome again to Prince William. We're energized by what you're doing, and we're going to work with you on everything. Thank you very much.
Yeah, we have to show